right. Well, it has been a phenomenal 2 days for so many reasons. And I just have to thank everyone, especially the group here who has stuck it out to the bitter end and given us so much valuable feedback. I have to say that this is a rare conference, an exceptional conference, just in terms of thought and feedback received, the energy that I've felt over the past 2 days for the need to move forward for this field nationally. And so many rich, very carefully thought through ideas in structure to move forward. Personally, I'm really excited to move this forward now. And not stop the momentum, and to begin to make this happen. And as such, I hope that we will look back on this 10 years from now as a seminal event for this field. We started off 2 days ago with the intent or goal of convening a broad range of stakeholders to create a united front and explore different approaches for advancing the report recommendations, and I think that we have achieved that. Just to summarize what we heard on day one, for the panel discussion on surveillance, we need to build on success of cardiac arrest surveillance efforts. There are many out there. The consensus, if you will, was to not potentially recreate the wheel, but build on what is existing and already determined to be successful. Identify accountable, capable champions to lead the cardiac arrest surveillance, and secure sustainable funding and resources, which is a fundamental aspect to all of these proposals and IOM recommendations. For challenges and opportunities in research and translation, I thought that was a very rich discussion. Identify and address causes of disparities in cardiac arrest survival. Translate findings of basic science into real-world cardiac arrest treatment. And support that process in the translational research spectrum. Cultivate sustainable funding through, I thought, some innovative ideas. Dr. Yiannopoulos suggested both public-private partnership, a pooled amount of financial resources targeted towards cardiac arrest initiatives that met the highest caliber in terms of application. Leverage a broader spectrum of stakeholders, and also to raise public awareness. Public awareness and training. It is a fundamental problem in this country, and despite these beautiful videos that we saw at the conference, all of the work that both Red Cross and American Heart have done over the years, and still we have not really reached not only the public, but policy decision makers, funders, and even our own colleagues in the field of medicine. It came out as a very, very significant issue that we need to address, especially through a collaborative. So utilize professional marketing services to develop a shared, simple, succinct message about cardiac arrest. Capitalize on the unique strengths of current and emerging medias and technologies. Social media to develop effective, targeted messaging, and solicit the advocacy of survivors, rescuers, family members, and non-survivors who are such a powerful tool for education, communication, and positive change. I do think that in the terms of public awareness, we heard over and over and over again that we need to change the culture of inaction into a culture of action. Hospitals, enhancing hospital response to cardiac arrest, develop and make publicly available performance measures for hospital-based treatment of cardiac arrest. There was lots of discussion and suggestions about standards and certification. develop a national data dictionary, create CQI incentives to encourage hospital leadership to measure and improve treatment of cardiac arrest, and I think we should add establishing certified centers, resuscitation centers also. Enhancing EMS response to cardiac arrest. Convene a summit to develop a national action strategy to improve EMS performance through quality assurance and training for emergency medical dispatchers, and the development and adoption of minimum PSAP training and performance standards that include dispatcher CPR protocols. Create incentives and penalties to foster commitment to a culture of continuous quality improvement and improved performance among EMS and EMD services and personnel, and pursue research on and promote adoption of emerging technologies that advance public and EMS capacity to respond to cardiac arrest. And I guess I will pick on this particular issue. It's not specific to it, but what I heard over and over and over again was the problem in this entire field of lack of accountability. The lack of accountability has led to kindness of strangers, new adopters, people who are very interested in doing it, but then these areas of complete failure in this country to achieve even minimal standards of acceptable resuscitation practice or survival. So it's the lack of accountability and the various methods to achieve that systemically throughout the chain of survival. Today, we talked about probably one of the most important issues, I think, for the entire conference, and that's establishing a collaboration. I think we just heard that there was almost, if not complete, unanimous enthusiasm for moving forward with the development of a national cardiac arrest collaborative. The purpose is to achieve a collective goal that cannot be achieved alone, and setting national aspirational goals related to patient outcomes. The devil's always in the detail, but the feedback we got that we just shared, I think, is a great starting place to begin to make that a reality. And as you heard, we will move forward with that, beginning with the program planning committee members with a first conference and meeting within 6 months. One of the overarching themes over and over and over again was culture. And it's so fundamental. Now, it started off with the public, okay, changing the culture of inaction into a culture of collaborative action. And I could really say that that was true for every single subgroup and session that we talked about. So it isn't just the public, but it's also dispatcher-assisted CPR. It's emergency medical services. It is hospital-based care. It's our own colleagues that need to understand that a comatose cardiac arrest survivor in the emergency department is a salvageable human being, and that, yes, they do deserve to go to the cath lab and to get therapeutic hypothermia and to get the types of interventions they need, and that if we do that systemically on a consistent basis, we can expect a substantial doubling or more of neurologically intact survival from cardiac arrest in this country. So we've seen what our mission is. We have a structure to move forward. And we have the tremendous recommendations from the great minds of the participants in this group over the past 2 days. Personally, I am very excited to move this forward, and we will see you in 6 months for the first meeting. Thank you.